Welcome to the next episode of What's Crap on WhatsApp, the voice note show that investigates the crap shared in your WhatsApp groups. I'm Andisueme from podcasting company Volume.
I'm Kate Wilkinson from Africa Check, the continent's leading fact-checking organization. Today, we have 3 claims to investigate.
Has Pfizer warned that the COVID vaccine carries risks of birth defects due to genetic manipulation?
Can typhoid be cured with a coconut fiber infusion?
Did the BBC say that breathing too many times a day increases risk of heart attack?
Let's get fact-checking.
First up for today is a screenshot posted on Facebook in South Africa, which says a document by Pfizer warns that its COVID-19 vaccine can cause birth defects due to genetic manipulation.
The screenshot reads, page 132 of Pfizer vaccine. Basically says no unprotected sex up to 28 days after second dose due to reproductive safety risk. This is for males and females. Birth defects due to genetic manipulation.
Below that is a blurry reproduction of part of a document that seems to read Appendix 4, Contraceptive Guidance, and then Male Participant Reproductive Inclusion Criteria. It also provides a link to the document.
The Pfizer vaccine has been found to have a 90% efficacy rate in preventing COVID-19 and extremely high effectiveness in preventing serious COVID illness. Unlike traditional vaccines that use a weakened form of a virus, it uses messenger RNA. This builds the virus's spike protein, prompting an immune system response.
So what about this claim? The link in the screenshot goes nowhere, but using keywords from the blurry text, we were able to track down a document published on the Pfizer website in November 2020.
The document is not a medicine package insert warning of side effects. It's a report that details Pfizer's 3-phase clinical trial of its 2 candidate mRNA vaccines.
The portion of the report in the screenshot sets out contraceptive guidance for men and women taking part in the trial.
It says that for 28 days after the second dose, men must agree not to donate sperm and to use a condom during sex, and women of childbearing potential must agree to use an acceptable form of contraception.
The guidance does say these measures are needed to eliminate reproductive safety risk of the study intervention, but nowhere does it mention birth defects or genetic manipulation. And birth defects due to genetic manipulation does not appear in the CDC's list of possible side effects.
Nor does it appear in a package leaflet on the vaccine produced by the UK Medicines and Healthcare Products Regulatory Agency.
The screenshot is crap. Next on our list is a Facebook post that claims to have the ultimate solution to typhoid and a blood booster. The message continues saying, "This is coconut peel for typhoid or to boost your blood. Dry it well with sun and cook it with a pinch of potash. Drink a cup morning and night. Check yourself within 2 weeks and see how typhoid will fly away." The post concedes the advice is not from a doctor.
So let's get down to the facts. Typhoid fever is a life-threatening infection caused by a bacteria. It spreads through contaminated food and water, and there is currently an outbreak of typhoid in South Africa.
The symptoms of typhoid include prolonged fever, fatigue, headache, nausea, abdominal pain, and constipation or diarrhea. Severe or untreated cases of typhoid may lead to serious complications or death.
Typhoid fever is most common in parts of the world that have poor sanitation and limited access to clean water. Children are most at risk because their immune systems are still developing.
Africa Check asked Dr. Rotimi Adesanye, a family physician, if the remedy would be effective. This is not a medical treatment, nor does it have a scientific basis, he told us. Even if coconut fiber was found to have medicinal value, it can't be taken in the raw state. It would have to be subjected to analysis. Dr. Oluwatosin Akande, a public health physician, also said the remedy was not supported by science.
Both doctors advised people with symptoms of typhoid to see a qualified healthcare professional as soon as possible.
And according to the World Health Organization, people with typhoid need to maintain proper hygiene to lower the chances of passing the infection on to someone else.
This claim is crap.
Last on our list is a shocking screenshot of what seems to be a BBC article doing the rounds on Facebook.
It says, breathing too many times a day could raise your risk of a deadly heart attack.
The screenshot carries the masthead of BBC News and shows a photo of a man clutching his chest. Text below the headline reads, "Trial found that people who breathe more than 5% above the daily average had a rise in blood pressure and increased risk of myocarditis."
It's quite a big claim. Myocarditis is an inflammation of the heart muscle. High blood pressure increases the risk of conditions such as heart disease, heart attack, kidney disease, and stroke.
We did a thorough search of the BBC News website for an article with that headline, and it returned no results. We could find no evidence that the BBC had ever published an article claiming that breathing too many times a day can cause a heart attack. The screenshot is fake.
The Mayo Clinic says that some of the symptoms of a heart attack include pressure, tightness or pain in your chest or arms, nausea, shortness of breath, and fatigue.
The causes of heart attack listed on the clinic's website do not include breathing too many times a day.
And it can't be found in the UK National Health Service's list of the causes of high blood pressure, or in the British Health Foundation's list of the causes of myocarditis.
The claim has also been debunked by other fact-checking organizations. So it's crap?
Dangerous crap.
That's all the time we have for today. Your friends and family can sign up for our show over WhatsApp. The number is 082 709 3527. Make sure to save us as a contact in your phone and send us a message.
You can find the show wherever you get your podcasts, from Apple to Spotify. If you listen there, you'll find show notes and a link to the fact checks.
Remember that you can send us a WhatsApp message, a picture, video link, or a voice note that you need fact-checked. Just forward them to us on WhatsApp. Our theme song is composed by John Bartman. I'm Andisueme.
And I'm Kate Wilkinson. Bye for now.
Volume.